Thank you very much, Mr. Chairman, and I stand behind everything that Dr. Burgess said. He and I have a bill which we are talking about today and we'll be voting on tomorrow, the Gestational Diabetes Act, known as the GEDI Act, which we sponsored together. And I just want to, since I didn't make an opening statement, make a mini opening statement now and just say that 135,000 women in the U.S. are diagnosed with gestational diabetes each year, and it can occur in pregnant women who've never had diabetes before, but who've had high blood sugar levels during pregnancy. And while gestational diabetes generally goes away after pregnancy, it can have significant health impacts upon both the mother and baby. In particular, women are at much higher risk of developing type 2 diabetes in the future, and their children are at higher risk of obesity and or the onset of type 2 diabetes as adults. That's why we introduced this act, and the bill aims to lower the incidence of gestational diabetes and prevent women afflicted with this condition and their children from developing type 2 diabetes. We need to have a greater understanding on how to prevent and treat this condition. There is currently an insufficient system for monitoring cases of gestational diabetes to uncover trends and target at-risk populations. In addition, new therapies and interventions to detect, treat, and slow the incidence of gestational diabetes need to be identified, and our bill will help us accomplish these goals. I know Dr. Burgess mentioned that all the groups that support this legislation, I'm going to mention them again: the American Diabetes Association, the American Association of Colleges of Pharmacy, American Association of Diabetes Educators, the American Medical Women's Association, the Association of Women's Health Obstetric and Neonatal Nurses, and the Society for Women's Health Research. Mr. Chairman, if Dr. Burgess hadn't done it, I think he did, as I was coming in the room, I would like to request unanimous consent that the letters of endorsement be entered into the record. So
I believe they all have.
Okay, thank you. And let me ask Dr. Arias, based on what I have said, can you tell me what support and outreach programs are currently available to those with gestational diabetes? And also, is there currently a system in place to monitor cases of gestational diabetes?
Monitoring gestational diabetes specifically would be a new activity for us. As I mentioned earlier, we do comprehensive diabetes prevention work, and in the context of that, if the issue gets raised, then we devote whatever resources we may have in order to address the issue.
What more can be done in these areas, in your opinion?
At the risk of being repetitive, it is surveillance and making sure that we're very clear about not only the extent of the problem, but where the problem seems to be most and where it is that we need to focus in order to be most effective in addressing the issue from a population-based perspective.
Thank you. Let me ask you one final question. Can you speak to the unique differences between gestational diabetes and other forms of diabetes like type 2? And is there a way to determine if a woman's at high risk to get gestational diabetes?
I'm afraid I'm not a subject matter expert, and that's information that then we can follow up and send you.
Okay. Can anybody else attempt to answer that at all? No? Okay. Well, I hope, Mr. Chairman, I'll yield back the balance of my time. I hope that that the committee can tomorrow unanimously pass this. This is obviously not a partisan bill. This is a very bipartisan bill, and gestational diabetes doesn't happen with people belonging to one political party or another. It happens to Americans, and I think this is something whose time has come. We need to address this very serious issue. I yield back.